Hi, I'm Kathy Porras, and I will be demonstrating how to administer a subcutaneous injection. I will gather my supplies. I have my gloves, alcohol swab, and then I have a 25 gauge. Sorry. Yep, 25 gauge, 1 inch needle, and then I have a 3 ml syringe, and then the medication vial, the gauze, and we can use a bandage if needed. Okay, I will verify the 6 rights of medication administration. Have the right patient, right drug, right dose, right time, right route, and right documentation. I will calculate the correct medication dose. So the doctor has ordered 1,000 units of heparin, but the available concentration is 10,000 units per 10 milliliters. So after calculating the correct dose, we are going to administer 1 milliliters or 1 ml. So I will now enter the patient's room and close the door for privacy, and then perform hand hygiene. Hello, my name is Kathy, and I'm going to be your nurse today. Can you confirm your full name and date of birth? Okay. Do you have any allergies to medication, food, or anything else? Perfect. So your provider has prescribed heparin. So it's a blood thinner given as a subcutaneous injection to help prevent blood clots. Possible side effects may include mild redness, swelling, or slight discomfort at the injection site. So you may feel a slight burning or stinging sensation during the injection. So please let me know of any unusual reactions like severe pain, excessive bruising, prolonged bleeding, or difficulty breathing. Do you have any questions before I begin? Perfect. So I'm going to perform hand hygiene and put on some gloves. Okay. So now I'm going to verify the correct medication, and then I will clean the vial's rubber top with an alcohol prep pad. And then I'm going to get my syringe. I have 3 ml syringe with 25 gauge 1 inch needle. Okay, so I'm going to draw air into the syringe equal to the prescribed dose. So it's just 1 ml. And then I'm going to inject the air into the vial. I'm going to invert the vial, and I'm going to withdraw the correct medication dose. Okay, and then tap the syringe to remove air bubbles and expel excess air. Okay, so now we're going to verify the dose again, which is 1 ml. We're going to select an appropriate site. Sorry, I'm going to recap the needle first. Okay, so we're going to select an appropriate site, and avoiding bruises, inflammation, or tenderness. And then when we inject the heparin, the recommended sites are thigh or abdominal area, And we're gonna administer the heparin at least 2 inches to the right or left of the umbilicus. And then we're gonna clean the site with an alcohol swab, starting from the center and moving outward in a circular motion, about 2 inches or 5 centimeters. And we're gonna allow the area to air dry completely without touching it. Okay, and then we're gonna hold the syringe like a dart between the thumb and the forefinger, and then we're gonna pinch the site using the non-dominant hand and insert the needle quickly at a 45 to 90 degree angle. Okay, and then we're gonna hold down here, and then we're gonna administer. We're gonna stabilize the syringe with a non-dominant hand, and then we're gonna inject the medication slowly over 30 seconds. Okay, so now we're gonna withdraw the needle quickly while gently placing the gauze over the site. Okay, and then avoid massaging the area and apply a bandage if necessary. And then we're going to dispose of the needle and the syringe into a sharps container without recapping it. Okay, and then we're going to remove our gloves, perform hand hygiene, and I'm going to document the procedure.